On this episode of 26 Minutes with Dr. Warren Siegel, I'm excited to be joined by Dr. George Juang, a leading cardiologist, as we delve into an important discussion on how to keep your heart healthy. We'll explore practical tips, the latest medical advancements, and lifestyle changes that can make a big impact on your cardiovascular health. Stay with us as we empower you with the knowledge to take charge of your heart health and your overall well-being. Dr. Juang, thank you so much for being on the show today.
Thank you for having me, Dr. Siegel.
So tell me a little bit about yourself. Where you're from, what do you do?
So, I've had a long relationship with Brooklyn, ever dating back to my father's residency days. He actually was training at a Methodist and Kingsbrook Jewish. So we actually lived in Brooklyn when I was a youngster. And now it feels like it's coming back home to have spent the last 10 years over here at South Brooklyn.
So what kind of doctor was your dad?
So he was a radiologist. He ultimately became the director of radiology at Kingsbrook for a number of years. And now he's retired.
So you've grown up in Brooklyn?
So I grew up a few years in Brooklyn. And then we moved to Queens, and then now we're on Long Island.
So what do you do here at South Brooklyn Health?
So I'm part of the Division of Cardiology. The Division of Cardiology, and my official title is the Director of Electrophysiology. So the Division of Cardiology comprises non-invasive, invasive, interventional electrophysiologists, and we're a teaching hospital. So we have a nice program training the residents and the fellows to become doctors in the future.
So when you talk about a cardiologist, you said you're an electrophysiologist. Does that mean you're a cardiologist first and you have a specialty within cardiology? What does that mean?
Yeah, that's correct. So to become an electrophysiologist, you have to put in your years in medical school, then you come out and do your internship and residency in internal medicine. Then you embark in general cardiology for a few more years. And then finally you end up doing a couple more specialized years in electrophysiology.
So where'd you go to medical school?
So my medical school was University of Chicago.
Ah, okay. Yeah. And then you came back to New York
then
for residency?
I went around the country a little more.
Where did you do your residency?
So I went to UCLA for a few years, the Ronald Reagan. Then I went back to Johns Hopkins for a few more years. And now I'm back in the New York area for the last 20 years.
Wait, so you went to medical school in Chicago?
Correct.
Then you went to UCLA in California, and that was for residency?
That's right.
And then I lost you after that.
Then 5 years in Hopkins for cardiology and
at Johns Hopkins in Baltimore, where you did internal medicine and cardiology?
In cardiology and cardiac electrophysiology.
And cardiac electrophysiology, that's even hard to say. And then how did you wind up deciding to come back to Brooklyn? We're very lucky to have you, but what made you decide to come back to Brooklyn?
No, I think you can't, New York is the way you want to be. Throughout my travels, I've always wanted to come back.
Yeah, well, we're very lucky to have you. Tell me a little bit about what does a cardiologist do? If I'm seeing a cardiologist, why would I see a cardiologist? What do they do? So
a cardiologist helps to take care of your heart, helps to maintain a good, strong heart. Cardiovascular disease is one of the most prevalent diseases in this country. And as you get older, the risk of having cardiovascular disease increases. So what we try to do as a cardiologist, we try to improve your overall cardiac health, try to make you live longer, and try to make you live better.
Well, that sounds like the kind of thing we want, right? This show is all about prevention.
Right.
But I mean, everybody's got a heart, right? So should everybody see a cardiologist?
I think that might be a good idea in the end, because in the end we can always try to decrease the risk factors that are involved in making cardiac disease more prevalent.
So what are those risk factors? What are the things that people should stop and say, wait a minute, I should see a cardiologist? What would make somebody say, I need to make an appointment with you?
Oh, very good question. So there's a lot of known risk factors that you can control. There's a couple of risk factors you can't control, like picking the right parents and having the right genetic phenotype. But then, short of that, you can start looking at simple things. So one of the biggest risk factors for heart disease is smoking. If you look at the incidence of smoking, it correlates very closely with incidence of cardiovascular disease. The more you smoke, the better chance you have of having cardiovascular disease, having blockages in the heart, having heart attacks or strokes in the future.
So when you talk about cardiovascular disease, are you just talking about the heart, or are you also talking about high blood pressure and other things related to the heart?
Right. So though high blood pressure is another important factor in worsening cardiovascular disease. So to fix the problem, a lot of times you want to stop it before it happens. So you want to mitigate the problems by stopping the smoking. So stopping the smoking is very important. And I think as time goes on, we see that our smoking cessation programs in this country have progressively decreased the number of people smoking. And then if you're still smoking, we have a lot of good medicines to try to help. And when you see a cardiologist, the first thing he's going to ask is, are you smoking? And if you're smoking, then he's going to try to decrease the smoking that you do. So there's medicines that you can buy over the counter, such as the nicotine gum and the nicotine patches. Those have it's hard to quit nicotine when you're using a nicotine replacement. But there's even better medicines than that. So there's medicines such as bupropion to help improve your mental status. And then I think the best medicine in this day and age is varenicline, or some people used to call it Chantix. The generic name is varenicline.
So these are things that a cardiologist would prescribe to help me stop smoking if I'm struggling with smoking?
Oh, definitely.
Didn't know that. That's very interesting. I always think going to a cardiologist, they're going to say, hey, this is the state of your heart, now go see your primary care internist.
Right.
So if I want to see a cardiologist, is that something I need to be referred to you from my primary care internist, or can I just make an appointment?
Now, oftentimes you can pick up the phone and call the cardiologist's office, and we can facilitate the initial visit.
So again, if I'm obese, if I am smoking, I should probably see a cardiologist. Are there other risk factors that I should think about seeing a cardiologist to help me improve my heart health?
Right. So good question. So obesity is a very interesting problem in this day and age. We know that obese people, as time goes on, they have a tendency to develop heart disease and heart-related ailments. So it's in the last few years, there's been a revolution in the types of medicines that we can give obese people to decrease their cardiac risk. And I think a lot of the audience already knows these drugs. They're the GLP-1 receptor antagonists. So these were developed as diabetes medicines. But 10 years ago, more than 10 years ago, the diabetes medicines that were on the market, some of them ended up hurting people by worsening heart disease and by decreasing mortality. So by increasing mortality. So what happened is the FDA yanked those drugs off the market and made it a mandate that any new diabetes drugs have to run cardiac studies after they get FDA approval.
So again, I could go to see a cardiologist and get a prescription for some of these medicines to improve my heart health?
That's right.
Even if I'm obese. I think of seeing, a patient who's obese, they would have to go to their primary care internist. So I'm not sure where your specialty begins and where the other ends.
There's a huge overlap. You're correct about that.
That's very interesting.
There's a huge overlap. And if these drugs that we're talking about, the newer drugs, are all becoming cardiovascular drugs. So the cardiologists over time can use them very effectively. So I think we work hand in hand with the internists, with the internal medicine doctors. So if you're already having all your risk factors controlled on the internal medicine side, we say, great. If they're not being controlled, then we go ahead and help control them.
This is fantastic. So again, it's a team approach. It's not one doctor. How often should I see a cardiologist if I have risk factors?
So you can see them quite often if it's an ongoing process to mitigate your risk. So If everything's stable, then the internist might just say, come back once a year. But oftentimes when we're in the middle of drug titrations or increasing drugs, then you come back a little sooner.
So let's go back to risk factors.
Yeah.
Obesity, smoking, you said genetics. Based on my family history, I assume if they've had heart attacks, then I'm at higher risk. Any other things we should think about?
So 2 other big ones, high blood pressure and diabetes. So high blood pressure, is very easy to diagnose and control. In this day and age, there's a ton of blood pressure medicines. If your blood pressure is high, then you should be on one of them. And nowadays, the range of normal blood pressure is like every year or so, the guidelines decrease the blood pressure a little more. So in the past, it used to be less than 140 systolic is considered normal. But now, probably the best is about 120 to 130.
When you say systolic, you're talking about the top number,
the top
right?
number,
yeah,
right.
The top number. We've done segments on high blood pressure here, but again, I didn't realize there is such an overlap between the cardiologist and the internist.
Right.
I think of a cardiologist, you go see him when you have chest pain, when you're having a heart attack.
Right.
So your job then, I guess, is to work with patients, to work with their internists, to make sure that they don't have a heart attack, that their heart stays healthy. Are there things that we can do proactively? You said don't smoke, and if you smoke, stop smoking, I assume.
That's right.
If you're overweight, exercise, lose weight. Those 2 things are pretty difficult for people, but you make a great point that, there's medical help out there. Are there other things that you would say, hey, if you're worried about your heart health, these are the things to do to make you healthy?
Yeah, very good question. Exercise is extremely important. So we realized that as the years go on. Back in the 1950s when Dwight Eisenhower had a heart attack, they made him lie in bed for a few months. Nowadays, we don't agree with that type of approach. Nowadays, if you have no cardiac disease, you still should be doing some sort of exercise every day or weekly, as little as just walking around for several minutes. If you have had a heart attack, then we try to get you into a cardiac rehabilitation program and have you learn how to exercise and get your heart back in shape after the heart attack.
So let's talk about somebody who's worried about their heart, they want to be healthy. Right. You're saying exercise. When I think of exercise, I got to go to that gym. I hate going to the gym. I never have the right outfit. I never look as good as everybody else. What kind of things can we do without spending a lot of money? What kind of exercise do you suggest?
Very good question. Number 1, walk around as much as possible. Very easy to do. You're walking around, you walk twice a day. You don't have to work up a sweat, but just the mere fact that you're moving is very good. Number 2, try not to take any elevators. You see an elevator, take the stairs instead. That stair climbing is great exercise. You don't necessarily have to go to the gym to do these things.
And when you talk about walking, are you talking about walking a block? Are you talking about walking a mile? How much walking should I be doing?
Whatever you can. So some people, 15 minutes, 30 minutes, walk slow, walk fast, it's all fine. You don't have to work up a sweat if you don't want to. If you want to, then go ahead. Go ahead and do the jogging, go ahead and go to the gym and get in your other treadmill work.
I'm thinking about people who are sedentary, people who are overweight, people who might be smoking. That 1 block or 2 block walk could be a big deal. Is it even worth it?
It's very worth it. And then, even if they can just do 1 block, it builds up over time. Yeah, so you can start off with whatever you can do, 1 block, but then add a few feet every so often, and pretty soon you're walking half a mile.
And are there tips for people who are, elderly, homebound? What do we do? What do you suggest to patients in the wintertime when it's, I can't really go outside and take a walk? What do you tell them?
Whatever you can do inside is fine. If you want to do it inside your home, or in the past, a lot of people went to the malls before they started closing and walked around in the malls indoors. So all that is very good to all that is very good for your heart.
So we talked about risk factors.
Right.
We talked about non-medical ways that you can reduce your risk. You're talking about get your blood pressure checked,
Right.
get treated if you need medication.
Right.
You talked about exercising. If I already have coronary artery disease, if my blood pressure is already up, I've
Right.
got problems. Where do you come in as a cardiologist? What do you do?
All right, so say you have coronary artery disease, say you already had a bypass or a stent or a heart attack. In this day and age, one other risk factor we haven't talked about is cholesterol. So the cholesterol story is very interesting. There's different types of cholesterol in the body. There's like the high density lipoprotein, there's the triglycerides, and then there's a low density lipoprotein, the LDL. So the LDL is the part of the cholesterol that we know if you decrease it, it becomes very beneficial to decrease your risk of having heart attacks, strokes, or dying.
So the way I remember this in medical school is the HDL is the happy cholesterol, and the LDL is the lousy LDL. Is that true?
That's
the
true.
one, right? That's the way I remember it. So you want to keep that lousy, the LDL low, and you want to keep the HDL high. Is that right, or is that really just too simplistic?
Well, the HDL story is it's difficult. It's a difficult story because in the past we tried to get these HDL increasing drugs on the market and none of them panned out. But the LDL story is very solid. There's solid evidence showing that decreasing LDL leads to decreased rates of heart attack, stroke, and dying.
And how do I get that down? Is it only medication, or is there something else I can do?
Medication is the best. Medication in this day and age is the best in terms of decreasing LDL. You can still do everything. Control your blood pressure, control your diabetes, control your weight. But then ultimately, if you have high LDL and you have heart disease, you want that LDL to go down as low as possible.
And is there, I don't know, are there foods I can eat to bring them down? Are there foods I should stay away from? This sounds very complicated.
I think the one food that you should not eat so much is red meat. So we know that red meat and inflammation of the arteries and coronary disease go hand in hand. So if you cut down your intake of red meat, steaks and the like, then the risk factors, the risk of having heart disease goes down. And then probably processed foods too. This is ongoing research. Maybe processed foods, the very highly processed foods, shouldn't be used, shouldn't be eaten.
When you talk about highly processed, you talk about deli meats and things like that?
Right, things like that.
Which also have a lot of salt, which raises your blood pressure. So it seems to be all connected.
It's all connected.
All connected. Really very, very interesting. Now you mentioned your specialty. I don't want to forget about your specialty, is electrophysiology. Can you explain that? That sounds really interesting.
So that's a subspecialty of cardiologists that deals with the electrical systems of the heart. So we're more of the electricians. So we deal with slow heartbeats, fast heartbeats. If your heartbeat's too slow, you can get a pacemaker. So a pacemaker will make that heartbeat back to normal. If your heartbeat's too fast, then we can do things like give you medicines, or we can perform other procedures such as ablation therapy. We can actually go inside in a minimally invasive way and find out where that fast heartbeat is coming from and eliminate it from the inside with a little bit of electrical energy.
Well, no, wait a minute. I thought your heart beats faster when you get excited, when you're exercising, for example, and when you sleep, your heart rate goes down. If you're an athlete, your heart rate goes down. You're saying that you can have a heart rate that's too low or a heart rate that's too high?
That's correct. So if, oftentimes as people get older, the heartbeat, the electrical wiring of the heart, so to speak, fibrosis, and then you get slower heartbeats as you get older. So
slower heartbeats.
Slower heartbeats.
Wow.
Yeah.
Huh.
And then at that point, the 90-year-old with a heartbeat of 20 beats a minute might not be feeling so well. So then you fix it with a pacemaker.
And a pacemaker is a device that's implanted in the heart?
That's right. So a pacemaker has the ability to beat the heart from the inside. So the standard pacemaker has leads that go from the outside can underneath the skin, and then it goes inside a vein and goes inside to the right atrium, right ventricle.
So you put those wires right in the heart.
Wires right in the heart.
And this machine is telling the heart, hey, keep beating.
Right. It keeps track of how fast your heart beats, just like your Apple Watch. Your Apple Watch, knows how fast you're beating, or your Fitbit. So same thing, the pacemaker knows how fast your heart is beating. If it starts to slow down, it kicks in and sends a signal to make that heart beat normal.
And this is part of the aging process? Does this happen to everybody?
Not to everybody, but it happens to a lot of older people.
So what can you do to keep that from happening?
To keep that, you do everything like we talked about, control your weight and the diet and your blood pressure, your diabetes, your cholesterol. So when you control that, sometimes it helps out. Sometimes it's just, you can't stop aging of the conduction system. Then your heart will slow down, and then you fix it with a pacemaker.
And what about the other end? You mentioned heart, just beating too fast. What causes that?
So there's various things that cause fast heartbeats. Sometimes you're born with the ability to go fast. You're born with the reentrant circuit, a place in the heart that wants to either go around and go beat faster with reentry or automatic. It just starts kicking in. Sometimes you develop fast heartbeats that are more pathologic. So as you get heart attacks or heart failure, sometimes you end up with malignant heartbeats called ventricular tachycardia-ventricular fibrillation, and then you have to try to fix those things.
And how do you fix that? Is that the pacemaker?
So the fast heartbeats can be fixed with medicines or defibrillators or ablation procedures, depending on how bad it is.
So a pacemaker is what you're telling you're reminding the heart to beat, and the other medications other treatments are to tell the heart not to beat.
Right, to stop beating abnormally fast.
Oh, isn't this fascinating? Yeah. So is this new? I think this is really exciting to think about not just a heart, but the way the heart is beating. Is this a new innovation? Is this a new part of cardiology?
No, it's been around for quite a number of years. It's been progressively. Some of my professors in the past were the inventors of some of these procedures, so they're still alive and well. So it's not that old, but it's actually a very solid part of treating cardiac disease at this point.
Fascinating. So if I decide I'm going to go see my cardiologist, I pick up the phone, I call your office, I make an appointment. What should I expect when I go through the door? What are the things that you're going to do?
Okay, so first thing, we do a very detailed history and physical. So we ask you a lot of questions about your past history and what you're currently doing and what medicines you're taking, and we put that all together. Then we'll most likely do an EKG just to see how fast the heart is beating. The electrocardiogram gives us an idea of whether your heart is beating normally or abnormally, too fast, too slow. And then at that point, we might make decisions on other investigative procedures to delve into your heart status a little more deeply, such as an echocardiogram. Echocardiogram is an ultrasound of the heart. So we're looking at heart muscle, heart valves, and whether or not you've had any heart disease or enlarged hearts in the past. We might put you on a stress test to see if there's a chance of you having heart disease.
And what's a stress test?
A stress test is where we make the heart either beat fast through exercise or through chemicals that we can infuse, and then we look to see if there's any signs of blockages by looking at the EKG or by looking at other imaging modalities with the stress test.
And you can do that all in the office?
And it's an outpatient procedure.
Don't have to be in a hospital.
Don't have to be in a hospital.
It's not a surgical procedure. You can do this and I can still go home.
You can go home, and then depending on the results, we start mitigating all the risk of heart disease.
A way to stay healthy.
A way to stay healthy.
Well, thank you so much. I really appreciate you being on the show today. That brings us to the end of our program today. We thank you for tuning in and learning alongside of us. For more information about our show, please call 718-510-2103 or visit us at www.zormed.com. Stay updated and engaged with South Brooklyn Health by visiting us online at www.NYC Health and Hospitals South Brooklyn Health. This broadcast was brought to you by Brick Media in partnership with South Brooklyn Health. Till next time, stay healthy and stay well. Thank you.